There's lots to talk about today with our medical expert, Dr. Payal Kohli. Thank you so much for joining us, Doc.
Hi, guys.
How are you? Okay, you got to provide some clarity because I'm seeing all over the place that is COVID back? I know that Philadelphia, right? They have reinstated their mask mandate. What does that mean for us?
So the CDC says we should be wearing masks indoors if either we're high risk or we live in a community that has a high level of transmission. Now, what's curious about Philadelphia County has a low level of transmission. So really what they're reacting to here, guys, is that they're seeing the number of infections double. So the rate of growth of infections is going up. So they're anticipating that they're heading towards that state where we're getting everybody infected again. So they're trying to be proactive instead of reactive by putting on the mask mandate. I think it's a revolutionary approach. I'm not sure the entire country is ready for it yet because we're really tired at this point in the pandemic.
Yeah. Right.
Do you guys think you'd be willing to put masks back on if they came back here in Denver?
I think I would, but it's so, I was thinking about this as I was getting dressed this morning. I was really thinking about this. I was like, and I don't think the country will do it. If we're being completely honest, I think we're over it. It's like a teenager, like after you ground them for the summer, they're like, nothing else you can do to me. I feel like no one's gonna do anything. I feel like a few people will. I don't think we'll see the mask hate, but I think that it'll just be unsaid that like some people are going to wear them and some people aren't. But I think people are done arguing about it. I think it's just either you are or you aren't. I don't think there's any more discussion. We talked for years.
Yeah. You know, our psychology is really interesting. If something gets taken away from us, we don't miss it so much if we never had it. But once we have it, and this is why the discussion about airplanes is really interesting to me.
That was my next question. Like, what are we doing with these travel plans, Doc? Summertime.
So, well,
it is.
You sound like Will Smith.
Do you have some trips booked out? Yeah, do you? All right, so the airline CEOs, what do they want to do for business? Of course they want to take the masks off. Science tells us it is definitely safer to travel with the mask on, not just for COVID, but for respiratory illnesses in general. But really how much safer depends on how much infection we have and how contagious the current variant is that's floating around. So today, taking the masks off of airplanes, we may be okay because 50% of us got sick with COVID in January, so many of us still have that immunity at least for 3 to 6 months. But come summertime, Al, when you're ready to go to Hawaii or wherever you're planning your next trip.
Trying to go.
New Zealand.
Yeah, trying to go do some shows, yeah.
Well, pack me in your suitcase.
All right.
Long flight. You're going down, is it down under in New Zealand too?
Close enough. Yeah.
Okay. And would you feel safer sitting on a plane full of masked people, or would you be comfortable with unmasked people?
Masked, but I mean, I know that's probably not going to be unless they change the policy. I know it's, and I'm assuming that risk as well. I'll have my mask on, but I will not say anything to anybody next to me. That's their business.
Or you could be in the suitcase, maskless.
There we go. Sam in the overhead.
Hey, I'm flexible.
That's it. All right.
We can put her in the special luggage rack, right? Yeah, like this case.
Doc, this is getting weird. All right. I also saw this story about stress. Apparently, 2 out of 3 adults say they're more stressed out now than ever before. So is stress just bad overall for your body?
Yeah, stress evolved to protect us from predators in the wild. That's why we had stress. But now we don't live in the wild. We live in apartment buildings or nice homes, and so all it does is bad things. Raises our cholesterol, our blood pressure, increases our risk of dying, lowers our immunity, increases our risk of cancer. So we really need to get rid of it, guys, and we need to work on ways to incorporate stress reduction techniques into our lifestyles. So what do you guys like to
drink more, right? Is that what you're saying?
No.
Deep breaths.
Deep breaths. I love that. Meditation is a big one.
No one really does deep breaths.
No one really does.
He goes to yoga almost every morning.
I know, but he's not doing it randomly just in his seat.
And
yoga,
you love
yes.
the namaste part, right?
I do.
Yeah.
You know, no, I love the part where you just lay down. We gotta go. Yeah,
Boston. Thanks, Tori.
that means it's over.
Over there. Okay, thank you, Dr. Kohli. If you have a question you'd like us to ask Dr. Kohli, write to us on social media or info@dailyblastlive.com.